this too loud? No. No. Very good. Thank you, Gary. It's sure a pleasure being here and seeing many of my friends. I've been coming out here 2018, about 18 years now. And I tend to avoid the summer. I live in northern Michigan. When I left there yesterday, it was 30 degrees below zero wind chill. And we like winters, but it's still cold. But that 115 to 120 in the middle of summer, that is hot. And I'm more used to living out in the country in northern Michigan. You know, we've reshaped the program real quick. And so I flipped back in my brain to one of the things I put up at my office at NACHC in Washington, D.C. Because working with politicians and the government, things can change like that. You never know who's going to do something, either brilliant or stupid. And but we had to respond. And so I put up on the wall where we would meet, to be flexible, nimble, and quick. And so we found out the food's late. So time to be flexible, nimble, quick. We'll get started. First, I just want to let you know a little bit about where this talk will go. I'm going to talk about why I decided to do this and make it my life. And then I think I've got about 10 3-minute stories that I hope you'll find interesting. I found lessons in them that I carry to this day. I think the patients, they were kind enough to teach me, because, you know, you're good when you get out, but you better hope, I hope you're going to get better. And they were good patients, and they were helpful. We'll talk about what's up here at the end of the talk. But this, for me, started in the 70s. And in 1972, I got my draft number, but it didn't go up to me. And so I wasn't drafted. I had friends join, because it's better to join and maybe be an auto mechanic than to be drafted and put onto the battlefield. So they would make very tough decisions. I had another friend decide to go to Canada because the borders back then were so porous, and Canada would let you in through the rural roads and let you out through the rural roads. And, oh, you're just moving? Okay, give me 1 minute. And so I'm looking at them thinking, what are they giving up? And in service to our country. And what am I doing? And I said, if they can do that, I can take the gifts that I have and be in service to our country. And I looked around and decided that all these uncared for, poor people, socially isolated, not treated fairly because of their gender, their race, religion, etc., that they all deserved the best quality health care in the United States. Not good. I wanted it to be the best. I don't really know the Bible well, but I think somewhere in there's something, take care of the poor people, and you're on a good road. So that's what I decided to do. I've been doing it my whole life, and why don't we grab some food, but promise me you're going to come back, right? Anyway, get started. Okay, we talked about flexible and nimble. I just did that part. We're down to 30 minutes. Now it's quick. So you heard why I ended up picking medicine, but I want to remind you guys to remember your vision, your dream, your aspirations. You're early in your career. Things are going to come up over the next decades, opportunities and things. But I think it's most pure when you're at this point. You know why you chose this. And money will pull you somewhere. Other things will pull you somewhere. And you do have to change. I changed. I left clinical medicine. We'll get to that. but I did it for the right reason, I believe. So I also want to start by saying, you'll hear me clear my voice a lot. I'm also sitting down. That's probably what you'll notice the most. I have Parkinson's. I've had it for about 11 years. But I'm doing good. Your PT program is helping me and get a lot of advice, and so I'm doing fine. But I don't walk around much. If I hold this paper, it will shake. So we put it down, and I need to drink water and clear my voice sometimes. So just ignore that if you can. Let me tell you about the first week. Someday you're going to get out of your residency or graduate from your program and get your first job. Oh, what a great time. Finally, the top of the hill. Fully trained, certified, everything. You're going to get a paycheck. How cool. Then you go there. I went to a rural clinic which was designed to have 2 providers. When I got there, there had been 1 for 2 years, delivering babies as well. I was very happy that I joined them. Also, I did my 3 days of orientation, and on that Friday he said, by the way, next week I'm taking 2 weeks vacation. I haven't had a day off. I have now been at that place 3 days and have not seen a patient. Okay, and there he goes. And I'm thinking, what did I sign up for? And with whom? As I said in my notes to myself, I had some concerns about the leadership. And so, oh, and by the way, 9 months later, I was the chief medical officer. You know, you cannot lead in that laissez-faire style. You have to, you should be, you know, giving people, transforming their lives. That's should be your goal in leadership, transforming people's lives. So that's my first couple of days at the office. My first patient, man, show up, go in the office, put your stuff in your office. There's the door, the nurse walks out, puts the little flag up, your first patient. It was Rick Hawley, and all these people let me use their names, and they are their real names, because they found out how much I started teaching over my career. And people don't mind. They'll let you talk about them. They feel good. You learned something, and you're going to teach something. Rick came in. He was a young man, probably 16, runner, great runner, all-state type of runner. And he came in, had a little blood in his urine. It had resolved, but he's still there. And so I checked him out. I wasn't really that concerned. He was more concerned. I did a little workup. Everything was fine. He had no recurrence, but he was still nervous. Is this going to happen again when I'm running? I'm a competitive runner. Is this going to form a thing? Is this going to do something? And Rick, no, you should be fine. Everybody says you're going to be fine. Still nervous, and but I realized developing an empathetic bond with him and showing him compassion for his concerns, that my reassurance did more than any pill could. I could calm him down like that, but reassurance, and he found out he was okay and could also then take better care of himself, feeling better. He's now probably, if I'm 62, he's probably 50. I still see him, and he still likes reassurance. I mean, that's the way personalities are. That's my first patient. Very soon that week, I saw another person. Her name was Pearl Bennett, and her husband, Doug. This is rural northern Michigan. We're one of the biggest towns. We have 2,000 people. And they lived on their horse farm, and they were retired, still riding horses. He looked very good in a horse. She did not. They were the same age, but he was a horseman, and she rode with her husband, and that's how it looked. But she was also getting old, older than he, and faster, and she knew it. She was aging, and she was failing. She had thyroid disease and diabetes, arthritis, you know, go ahead, list it all. She's getting there. She fell and got a little fracture in her forearm. Nothing bad. And back then, for a long time, we'd cast it, all those things, until when you got done, your arm was stiff as a board, especially if you were old. And this was when they then started taking them off quick and starting to work on some mobility. And of course, Pearl, nervous as heck. You sure I'm not going to hurt it? No, you got to move it or you won't be able to use it. All right? And she came along and got over that, but then got pneumonia, middle of winter, and started having other organ failure. And it was in the hospital. You could see the end was there, and her family wished she would pass on. I wished she would pass on and hopefully go to heaven. But she was so nervous, just shaking. And her husband, Doug, came up and says, Doc, you got to do something. And I said, Doug, what do you want me to do? You know her. He goes, you're the only one who can calm her down. And, oh. So I said, yeah. I said, all right, Doug, why don't you come on in with me? And she was laying there, what's your name? Erin. She's laying in her bed, and I pulled up the chair on her left side. We're often taught to examine from the right side. So I pull up a chair, and I sit down near her as close as I can because I wanted my heart to be near her heart. So I'm holding her hand, and she fell asleep. So did my job, went out, did my rounds, come back. Doug says, she left. Boom. That was some of the best medicine I ever did. Excuse me. Moving around's hard sometimes. But Pearl left, and I realized something, and that there was a lot of other stuff powerful in medicine. So I helped her die. There was an evening nurse with great seniority at the hospital. She could have had any job. She was on midnights. Not necessarily. Isn't that where you put the recent grads? Send them on midnight shift or something? Or the bad nurses? She was great. Why is she on midnights? We're talking. And she said, oh, I'm there because most of the people in the hospital they're often old, they're ill, they're scared, they're alone, unfamiliar environment, no family or friends, and it's dark. And she said, I think it's a good time, she's talking about herself, for me to be there. So she's right. She also said something else, and you'll have to interpret it yourself. But she said to me, when you have something different than the other doctors. And I asked her, what was that? And she goes, when they come, they shoo the angels away. When you come, the angels come in. So paid attention to that. That I don't know exactly. I said, you'll have to interpret, shoo the angels away. Did we practice too much medicine? Did we go far too long? Make people uncomfortable? Spend all their money at the end of their life for 3 more days? But I heard that and thought that was powerful for me too. But you know, those are a couple of, yeah, that's a dying story. So we're going to go to the virgin birth story. I love working in northern Michigan. You know, you go in the office, mom's in there, all concerned about the youngest of her 3 daughters, who's got a low bellyache, 15 years old. Vague complaints. Mom thinks, is it appendicitis? Has it got a bladder infection? I'm looking, thinking, Is she pregnant? She's not sexually active. Is she pregnant? I just had a period. Is she pregnant? I need to get a urine and check that. And then I go to the mother. I'm going to check for the pregnancy too. She says, okay. Comes back. You know what the answer is. She's pregnant. So I think, well, number one, you're all taught, always assume they're pregnant. If it's a lady and they're in pain, just make an assumption perhaps. But the one line the mother used that I like, and she looked at me. Remember I said the youngest of 3 daughters, and she says, these girls are gonna kill me. And, you know, I didn't have children yet. So I didn't really, you know, as you go through life and you experience something, you become enlightened, you know. What does it feel like to get old? What does it feel like to have this problem or that? When you get it, you'll get new appreciation, believe me. But this, and oh, my other note is, I don't know how many times I heard that. Usually from mothers, these kids, not picking on women, these kids are going to kill me. And just have that empathy and compassion and say, but wouldn't you like to strangle them too? And they go, yes. So then you laugh, and they raise their kids, and everybody's fine, and we still are friends and talk, and that kid's got to be 35 now. Here comes a good one. 12-year-old girl, poor self-esteem, crying all the time. Mom asks why, and she says, because everybody calls me Stinky. Now, her father ran a trout farm, one of those things you see driving around, buy some corn, toss it in, you catch some trout, he cleans them, there you go. All right, I thought maybe she said, yeah, I leak a little urine. Thought maybe she had a bladder infection. I checked, she appeared to, treated her, seemed to work for a short period of time, and then failed. Didn't really make any sense. And I started to have an awkward feeling that something wasn't right. And I, you know, I'm at the point, do you get a urology workup, send her to an OB-GYN? I don't have what's wrong. And one time, she almost always came with her father and mother. She came with just her mother, and mother explained to me her father was sexually abusing her. And that's why she had all this pain, discomfort, recurrent infections. And he went to jail for a long time. And she got her life back, her dignity. It was fine. And he deserved to go to jail. So that's who Stinky was. And I'm young. I'm still like 31 or 2. I'm learning as I go. And, you know, think about what else it could be. Think hard. So then I get called to go in the room to see a baby boy. He's 4. He's real Mexican. Illegal migrant farm workers. And though back then it didn't seem to be that big a deal. It's not like nowadays. Kind of like the Vietnam vet, just go over the thing and come back. It was different. But, excuse me, the Vietnam conscientious objector. So anyway, they're there. He has a rash on his, I don't know what the Spanish word for derriere or butter is, but is a rash. I said, well, let's take a look. And I have never seen so many venereal warts. I mean, his whole anus, his whole area down there and into the opening of the rectum just full. And this is let me check my notes. It was 1986. No, 85. So I explained I had to call, I had a fear. And in the state of Michigan, I assume it's the same here. If you have a suspicion, you are obligated to report it. Is that right? So you got to. Mom said, we're going to get in trouble. I said, I have to. And they came and couldn't find any evidence of abuse, but did a much better medical history than I. Where were they from? Mexico. What part? Mexico City. Where were you in 1982? In Mexico City when the earthquake hit and the child was severely injured. It destroyed UNAM, the premier medical facility, was destroyed to the ground. Total new facility built. He had over 20 transfusions and obviously now had AIDS. And I added that, because it was a young disease then too, 85 isn't anywhere like it was. I mean, remember when, you guys don't remember, when Magic Johnson got it, a couple of us do. When Magic Johnson said, I got HIV, we thought he was going to be dead. He's going to be a skinny, scrawny little guy in 2 to 3 years and dead. Not anymore, folks. But back then, I didn't know enough. Anyway, his life didn't work out well for him, as you would expect. That was my first case. Take a good history. This story I love. And his name is Del Ingalls, oh boy, and his wife Celia. In their 70s, dirt farmers, dairy. My nurse had told me when I went there, because I'm from Manhattan, right? My grade school had more people than this town does. And so she explained, well, you know, you're going to see some patients come in here that you probably won't understand. He's going to come in, he's going to be dirty. They've made no effort to really clean themselves up. They got their work boots on. They smell like cow manure. And she goes, don't assume there's some poor farmer. He's probably running a $5 million dairy operation, and he came over right from work. And a good lesson, don't be fooled by that first appearance. Treat them all with the same dignity and respect. You would treat the owner of the bank who comes in all knotted up. That's his way of dressing. His wife was paralyzed. Nobody ever figured out why she couldn't move. And she's sitting in that wheelchair. The kids are all furious at every doctor in the northern Michigan and at Ann Arbor and at MSU. They want us to send her to like Costa Rica for some funny monkey blood treatments and stuff like this. It was a disaster. No one could figure it out. They pretty much quit working her up, and she just sat in the chair. So I'm talking to Del one day, and I asked him. I said, nobody can figure it out. I said, why, Del, do you know why she's paralyzed? He said, she's not. What? She's not paralyzed. She just won't get up. I said, what happened? He goes, some doctor humiliated her, and she got furious and got weaker and got in that chair and never got up again, except 2 times. Each time one of her grandchildren was having a problem with one of the farm animals, up like that, okay? So she was not paralyzed. It was a manifestation of some psychological trauma, and that's how she expressed it. But she was not paralyzed. But Del, still working on the farm, has a cow giving birth, and he's alone because his kids are grown up. Well, she's in the house, and I'm also not a veterinarian. Anyway, I guess it gets stuck. coming out. So then you go get, and if any of you guys are a dairy farmer, if you fix my story, I appreciate it. You pull the tractor up, and it's got a thing that you can take it out of gear and put the gear into this winch kind of thing. And then you put the harness around the part of the, it was coming out breech. I don't even know if, I assume they're supposed to come out head first. It's stuck. He's got it, turns it on, watching, trying to make sure cow doesn't, because you can lose the calf. You don't want to lose that breeding cow. And working, slip, bang, under the truck, and it goes into gear, under the tractor. He's trapped out there alone with the wheel spinning in first gear for quite a while. One of the boys comes over, finds him, does what we'd all do, move the tractor, calls an ambulance, went to the best hospital in northern Michigan, and he had a completely flail chest, complete, meaning every rib was broken in the front, every rib was broken in the back. And he's in his 70s. He should die. That is, it's a terminal injury. I mean, the man just been crushed by that, and he's going to get pneumonia or cardiac tamponade or something, you got a blood clot. Think of all the bad things that are going to happen. And Dell lived. That little buzzard, you know, he lived. And I'd drive 40 miles to go see him in the hospital. And then he went home, and he comes in to see me. And I said, "How's the pain, Dell?" He goes, "Well, it's not bad. You can live with it." I said, "Are you using any of the pain pills?" He goes, "No, they bind me up, and I'm fine." I said, "Really?" I said, "What's the worst part?" And he says, "Well, who's my next foil?" You. I said, "What's the worst part?" He goes, "Put your stethoscope on." So I did. And he says, "Now, put it on my back." He goes, "Now listen to this. Take a deep breath. All you hear are 28 cracks." Oh, boy. He goes, "Try sleeping with that, Doc." And I said, "I can give you something to sleep." He goes, "No, I'll get tired enough and fall asleep." But that was Dell. And let's see, any other thing? Oh, worst part was the noise, is what he said. I got about 6 minutes left, and I got 2 things I still want to say to you. Take a good history, I've mentioned. Also look for other sources. Does a cop only look at one place? Is Mueller, or however you say his name, only looking in one place? They're looking. They're looking everywhere, because it might be under there. Who knows? There was nothing there. I've known this woman for 4 years. She's bright, frisky, in her 70s. She hangs out with 3 other bright, frisky women in their late 60s, early 70s. They golf together. They see me on the golf course. They're all my patients. And what was Golden Girls? That was the name of that show. They were like the Golden Girls. They were all a little different, but they were best friends, golf, go get lunch, maybe one would have a drink, somebody would have iced tea. You know, it was their life. And they had a funny, quirky thing they liked to do to me. And that is, because if I don't have this beard on, and you get me just right, I embarrass well and flush. I mean, I turn red. And they found that out and would tell me subtle, mature woman dirty jokes. And they're, "Doctor, can I ask you a question?" And you're there, "Oh, no." "Yes." And I'm not going to tell it to you. But in private afterwards, I will. But not for the tape and stuff. But anyway, you know, then I've seen her, and she's a regular patient, still active, but she starts showing up with some vague complaints. pain in the pelvis. Kids are bugging her. She's not happy. She's dysmorphic. I can't really figure it out. And then one day she comes in and says, it really hurts down here. And I said, yeah, where exactly? And she pulls up her dress and has nothing underneath and says, right here. And I'm there. Okay, never seen that before from her. Something new is certainly different here, and I need more information because I'm not getting it from her. By the way, she didn't have a bladder infection or anything else. She told me to not talk to her kids, but it is a small town. So the kids came by and said, we've had all these problems with her, and we think she might have that senile dementia thing. And I said, and what else can you tell me about why she might have senile dementia? Well, she was quite a, is that macrame? Needlepoint? Thank you. Anybody can fix my talks, by the way. There are 6 of them. I could only bring 2 today. The others are in use. They're in chronological order. This first one is magnificent, which you don't see. It's a beautiful bouquet about 6 months before July 1990. That's still pretty good, but it's nothing like there. Then she did get a bladder infection. Then she got the flu. And then 7 months later, that's what her needlepoint looks like. And she thinks it's perfect. She can't see any difference anymore. And the last one is very sad. But again, it's just a stem, really ugly flower, 1 leaf, and some green somewhere. But I didn't have all the history. I didn't have what I needed to know to see the incredible decline in her cognitive functions, her visual spatial imagery, etc. So anyway, that's her. Treatment has improved a bit, still not very good for that. But my point on that one is to get a good history. And if you're going to go to the small town, I got to tell you, they say, you want to be a doctor, you want to be a PA, you want to be a dentist. Well, if you do, and there's only your partner, then that means you're also the county coroner. How many coroner classes do you guys run here? You know, I've seen Quincy on TV or whatever. That's all I know about being a coroner. Yeah, whoever the guy is. But, you know, they call you, somebody's in an auto accident, dead. Somebody's been shot. Someone just found dead in the store. On and on. And, but anyway, that was interesting. My first month there, the psychiatrist at mental health quit, so they farmed me out 4 hours a day, 3 days a week to sign charts. Real quality issues on that. But we were talking with one of the people over there. You got to do what you got to do. These people needed their meds, and we modified systems, and it got a little better, not great. So I hope you find those stories interesting. By the time I got to the end, a few years after this, I had started, my office had grown from the 2 of us to 14. We were now family practice, pediatrics, internal medicine, and psychology, and dentistry, and optometry. So we were humming, but I wanted it to be a little bit better, take it to the next level. Got involved in research first with MSU and the American Academy of Family Practice doing primary care research, and second, got a Kellogg grant to start doing teaching. Found out I could work well with universities, and I had some ideas that seemed to be appreciated, and the students did well. And I decided to take my career in a different direction. I said what I wanted to do. I wanted to be a country doctor, take care of my patients. That's what I wanted when I was probably around your age and applying. I still did, but I was seeing 1,500 people for 3 visits each on average, 4,500 visits a year. again and again and again. But I found out I had a different skill than some people, and so I decided to change, to leave clinical practice, to go into management, to work on programs like this and others around the nation, affect instead of 4,000 people. What's the number now? We got 22 million, 23? 27 million. And try to get those programs set up, innovative, visionary, forward-thinking, and have a bigger impact. The one thing I tell you, they say, what do you miss the most? If you go into management, you can go a long time before someone says, hey, thank you. When you see 15 to 20 patients a day, you get 18 thank yous. You go into management, it's like, yeah, all right. Anyway, thank you guys for coming, and I'll be around. So that's that.
Community health centers and public health today. It's amazing what he's done. And I can honestly say, and I think that Dr. Wendell back there, as we thought about what SOMA may become, and Dr. Cloud, Dr. Curtin, we see just this tremendous amount of success by our students and by the project. So it started with Dr. Curtin thinking about how can we better healthcare, how can we reach out to communities that need, and how can we open up a different medical school. He had done that with the ASDOH Dental School very successfully. So I had the honor to be, along with Dr. Curtin, to the ASDOH development, the SOMA development. We used to take all the SOMA students up to northern Arizona for 3 or 4 days at the beginning of their education. And you would come out every year and you would say, boy, it is hot here.
Get me to Flagstaff.
Get into Flagstaff and get it cooled down. But thank you for all that you have done for your patients, for this country, for healthcare, family medicine, and AT Still University. So we want to present you with a little AT Still. One of these actually come from Kirksville, and something that you can put in your office and cherish. I know you use ski pole right now, I think, to get around.
Yeah, walking stick.
Yeah, walking stick. And,
but this is much better. And I carry it in my left hand as I was, because it's closer to my heart. Thank you, buddy.
Thank you very much.